Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Many people have experienced moments when they find themselves relying on a substance to feel normal or to cope with daily challenges. Today, we'll explore the signs of substance dependency, which can manifest in various stages of use. It's important to note that this discussion is for educational purposes only and should not be considered as medical, psychological, or professional advice. Dependency is characterized by a growing need for a substance to function in everyday life or to avoid uncomfortable withdrawal symptoms. This dependency can develop gradually or sometimes quite rapidly, depending on several factors, including the specific substance, an individual's biology, and their patterns of use. A common misunderstanding is that dependency only occurs after long periods of heavy use. In reality, dependency can emerge even after relatively brief or intermittent use. Many people also confuse dependency with addiction, which is a broader concept. While dependency may be a component of some substance use disorders, it does not encompass all the criteria for addiction. It's also important to recognize that physical dependency isn't always obvious. Some might expect it to present with severe withdrawal symptoms, but often it manifests more subtly. It could involve mild discomfort or anxiety when not using the substance, rather than dramatic and clear signs of withdrawal. Understanding these nuances is crucial. Vigilance regarding usage patterns is relevant from the very beginning of exposure to a substance. For example, recurring thoughts about a substance, an increased tolerance, or unsuccessful attempts to cut down on use can indicate the beginnings of dependency. Changes in daily routines to accommodate substance use are also significant indicators. This awareness extends to prescribed medications as well. A person might find themselves developing a physical dependency on medication, which does not automatically indicate misuse or a substance use disorder. It's about recognizing that the body or mind may be adapting to the regular presence of that substance. When someone experiences changes in mood, sleep patterns, or appetite when they aren't using a substance, these can be early signs of dependency. They highlight how the body has started to adjust to the influence of the substance. However, it's essential to clarify what this does not mean. Not every instance of substance use leads to dependency. Many individuals can use substances without developing any dependency at all. The range of dependency can vary from mild to significant, and it does not always indicate a severe or life-threatening situation. Moreover, dependency does not include the specific diagnostic criteria for any substance use disorder. It is simply one aspect of a larger picture and does not predict the likelihood of developing a full substance use disorder. Rather, it serves as an important indicator of a potential shift in one's relationship with a substance. As we wrap up this discussion, we encourage you to reflect on these signs and what they may mean in the context of addiction and recovery. Topics like this are often explored in addiction counseling education. Programs such as those offered at InterCoast colleges include discussions about behavioral health and recovery support. If you'd like to learn more about educational pathways in this field, you can visit intercoast.edu.